Welcome, everybody. We are talking today about the role that the vagus nerve plays in metabolic dysfunction and gut dysfunction. If that sounds like absolute gibberish to you, don't worry. By the end of this talk, you will hopefully completely understand what we're referring to and how that might be playing a role in your chronic health complaints or chronic health issues. So everybody, I want to introduce you to my dear, dear friend and past business partner, mentor, sister, all of the things, Dr. Robyn Murphy.
Hello.
Yeah, what's up? Robyn's in her beautiful office there, newly renovated. I just love it.
My home, by the way. Yeah, home office.
Robyn's a naturopathic doctor, and she's also the scientific advisor for DNA Labs, so heavily focused in genetics. And she also focuses on gut and brain health for women. I have a firsthand experience with that. Robyn used to be my doctor and has taught me so much about the gut-brain connection. And I'm Cassandra Hope. I'm an RHN and a mindset coach, and I specialize in the gut-brain connection as well. So welcome. Hi.
Hi, thanks for having me.
Yeah.
It's funny because we always have these conversations and we're on the phone kind of talking about updates and research, and we're like, man, we really need to just put this out into the public. So I'm glad we're actually doing this. And you actually sent me a study that I dove right into, and I was enthralled. I haven't gone over sort of the vagus nerve and the impact that it has on like the immune system and even gut permeability. So I'm really excited to chat about it.
Oh my God, I love that. Like, we geek out the same way. It's so great.
Yeah. I got my highlighter and my my little notes.
So full disclosure, because Robyn's because you're so great with research, as my brain has been healing over the years, I am now at a place where I can actually read research. And in the past, I couldn't. It would cause severe anxiety. And it was this almost uncontrollable out-of-body experience where the confusion and the frustration, and it literally felt like a learning disability where trying to grasp words and concepts would create such tightness in my gut and such anxiety, like my muscles would tighten up. So now that my brain, I'm still working on it, but now that it's healing, I am pulling up this research and I'm like texting Robyn and I'm like, oh my God, I'm freaking out. Like, this is a whole new world of discovery, right? So the thing I love about you so much, one of the things that I love about you so much is your grace. You have all of this education and wisdom, but you're never hierarchical. Is that the word? There's no, I love chatting with you, and that's why I really thought this would be beneficial for people to pull in the science background, but also the way we play off each other, the conversation, how it flows, and the respect that we have for each other. Just creates such a beautiful space to learn from, for me anyways.
Mm-hmm. Thank you.
Yeah.
I agree.
Yeah.
Let's dive into it.
Yeah, let's do it. So I'm going to be sending out in the replay email with the link of today's video. I'm going to also include the link to the research that we're referring to. So, I guess the big question for me that I was like itching to ask you after you read the research was, what do you think?
Mm-hmm. So I think this is what we're talking about is a review paper that was going through how the vagus nerve, which is a part of our nervous system, it's a massive branch of our autonomic nervous system. So there's our vagus nerve, which is part of more of the parasympathetic nervous system. So this is rest, relaxation, digestion, trying to understand how this plays a role in gut health, but then kind of the process of how people become metabolically dysfunctional when they have obesity, and kind of how the gut and the interplay with the vagus nerve when it's not functioning properly, how that relates to one another, and how that then causes things like obesity, metabolic syndrome, and chronic inflammation that we see in obesity. So I think this is a really key paper because, and this is why I was so excited to kind of jump on a call with you, because this is kind of a missing piece in medical research, in kind of the conversation, even in clinic when we're looking at treatment. And a lot of times what we'll find is, patients come in with weight gain, rapid weight gain. They're doing everything from exercise to proper dieting or even starving themselves, and they're just not seeing the results. And so we know when that happens, and it's way beyond just calorie in, calorie out, but we know at that point that there's something that's missing, and we know it can be environmental, but I think this is another factor that we haven't spent a lot of time discussing or the public knows about. And there's so many cool ways for us to kind of support patients who are first, struggling with these issues, so that they can identify, what is the underlying cause here, and then two, how do we address it?
Yeah, exactly. So if I can give just I guess a little bit of background, like play it out, explain it through experience, or through almost like we can use me as a case study, for example. So let's pull it all together. So let's say, when I first met Robyn, we were working on my gut health, and we were doing everything that needed to be done. We were doing anti-infection protocols, testing, proper diet, stress management techniques. I've always been kind of on that stress management train of investigation. And I remember, feeling resolve. I remember getting better. And that's when we opened the IBS Academy, being like, wow, this is amazing. This is the thing. But I relapsed. And there was unfortunately a lot of shame in that relapse. And that's a whole other webinar. But what I love to stress to my clients now is we have to take the shame out of the picture, because if we are talking about the role that the vagus nerve plays and why the vagus nerve vagal tone isn't great, we also need to, consider and have compassion for what happened to the client or the patient to create that trauma, where it's not yours to own. It's not yours to own. It's not that you're doing something wrong. People are like, I'm not eating right. I'm not starving myself enough. Oh, it's that extra little bit of coconut milk that I'm having in my coffee that was bad. And it's like, no, we need to get this information out. So I remember coming into your office at your clinic, and we were doing that test with what's that thing called in the back of the throat?
Oh, for the vagal tone?
Yeah.
The gag reflex?
The gag reflex, yeah. Yeah. And we were laughing because I was like, I don't have a gag reflex. Like, I remember when I was doing my ayahuasca journey, and I wanted to throw up so bad, and I was trying to make myself throw up, and it wouldn't happen. And I was like, fuck this gag reflex. Like, oh. So that is a symptom that the vagus nerve isn't functioning properly. And we knew that. And we knew that, we'll talk about some of the practices that you can do daily to help to nurture the vagus nerve back into functioning properly. We knew those things, and I was practicing those things, but there wasn't like a massive focus on that. And that wasn't our fault. It's just exactly like you said, there was a big missing piece, which, as I've continued to work through my gut health issues and my brain health and all of that, it's become very clear that the role that trauma plays, mental, emotional trauma, complex PTSD, however you want to describe it, what that does to neural pathways and brain health and neural connections and neural networks, it repatterns the nervous system. So when we have these gut infections, you're clearing it with antibiotics, you're doing all the right things, you're eating a clean, low FODMAP diet, whatever, and people are relapsing. We've seen firsthand these what are they called? Forums, where people are like, oh, SIBO protocols don't work because I relapse. Mm-hmm. Oh, rifaximin doesn't work, I relapse. And it's like, we need to educate our patients and our clients on the full picture of what's happening. This is why I'm so excited, because I'm like, yes, this makes total sense, right? Mm-hmm. So if that helps to kind of if anybody's, unclear as to the role that the vagus nerve plays in not only metabolic dysfunction, obesity, insulin resistance, type 2 diabetes, we're going to dive into that, but also in chronic latent infections that don't seem to resolve. What do you think about that? How do you feel as a doctor about that?
Well, I got into medicine because I love learning, and being a doctor, it pushes you to always learn because we're always evolving our understanding of the body. There's mounds of research always coming out, depending on, it doesn't matter where you specialize in, it's a lot to keep up with everything, right? So it's our due diligence to be able to bring together other practitioners, other experts in their field. So this is excellent where we can look at bringing together trauma therapists and mental health workers and integrative physicians and doctors, functional medicine practitioners who are able to assess and say, okay, now I realize that, there's a significant past medical history where there has been trauma. And when we talk about trauma, what I'm realizing with patients is it's not what we always think of as, necessarily severe, PTSD from war or from, severe abuse or car accidents per se. It can be just emotional trauma, from emotional abuse, physical abuse, things that we may not think of as trauma. I think there's a label around that that people aren't realizing. Perhaps they do have complex PTSD. It's becoming more prevalent than we realize. And as we're assessing and getting tools to be able to identify people with this presentation, now we're starting to understand how this is affecting the nervous system and affecting chronic disease development. And so, especially with our, it's not even PTSD and trauma. We also see it with just chronic stress.
Yeah.
And it's not just, major stressors where people are, losing their mind and can't work. It's people who are, in that fight or flight chronically all day long. They have deadlines, they have family, they have social isolation, just stress with uncertainty. Depending on the ways that they've learned how to cope with stress, really will determine how their body is responding to the stress. And those patterns we develop really early on. So a lot of times we haven't necessarily been given the tools to be able to appropriately, come down from that stress response and kind of recover like we should be doing. And that recovery phase is really that vagal nerve response. So I think it would be helpful if we just kind of talk a little bit about, what does the vagus nerve do and kind of what the inflammatory reflex is.
Yeah.
So I'll just dive into that.
Yeah. I just, to round out what you just said, thank you so much. You've always had this that I've admired, and it's really helped to shift my perspective as a patient from being the victim in the medical industry. Oh, why did I fall through the cracks? Why didn't they see that? Why? And putting it on everybody else. When you've had this great explanation of like everything you just said, but also it takes at least 10 years for the research to be out there for the medical field to start to consider pulling that into their practice. And this research, this paper was 2014 or 2013, I think. This is new research. So it's going to take a while for the medical community, allopathic, holistic, to start to really get on board with this. I just feel like that's a really empowering kind of place to think as a patient, as opposed to, the opposite. So thank you for that also. And yeah, so what is the vagus nerve? What does it do? How does this relate to metabolic syndrome, et cetera?
So just, as a summary, the vagus nerve, it's gathering sensory information from our body, from our digestive tract particularly. So it's a huge nerve that runs down the back of our spine and sends out all these little nerves out into the digestive system to our organs. And it's constantly collecting information about, what is our micronutrient status? What is our macronutrient status? What are we eating? What's the level of inflammation in the digestive tract? What's the level of bacteria in the digestive tract? Are there any pathogens, bacterial infections, viruses, parasites that the brain needs to know? So it's constantly gathering this information. It's bringing it up into the brain. And then the brain is then responding in a particular way. So when we talk about specifically this inflammatory reflex, what's happening is the body is responding to bacteria in the digestive tract. When people are eating a high-fat diet or high-fat, high-carb diet, we see that there's studies that this will increase what's called LPS, which is a bacteria byproduct. And this is in healthy individuals. So they're increasing their LPS. The body's saying, oh, this is something I need to tell the brain about. Because LPS is causing inflammation. So it's causing the immune system to respond and create inflammatory cytokines. So that what happens is the vagus nerve will then gather this information and then send out signaling into the spleen and into the immune cells and into the digestive tract to then decrease the inflammatory response. And so it does this by suppressing different inflammatory pathways. It's called NF-kappa B. And it's done through a certain type of nerve called acetylcholine. So these are key information because once we know that pathway and once we understand how this works, then we can look at populations and studies that show where this relationship isn't working properly. And actually, those studies have been done to show that obesity and metabolic syndrome, we don't have this proper anti-inflammatory reaction of the vagal nerve. So rather than sending those signals in response to the bacteria, what ends up happening is it's called a vagal tone. The vagal tone is depressed, essentially. Yeah. And so you're not getting the same response. And what ends up happening is the inflammation perpetuates. And then that's causing a lot of downstream effects, which we can talk about, the effect on diabetes and everything afterwards.
Yeah.
Does that make sense?
It does, totally. I just wanted to take the essence of it. So why is it in those situations, just to like a macro idea of why is it that the vagus nerve is not functioning well in those people?
Yeah, so, studies have been shown to look at vagal lesions. So there's actually physical barriers that are preventing the body or the nerve from conducting properly. So I have seen patients with abdominal surgeries, motor vehicle accidents, where the scar tissue impinges the nerves. And so this causes reduced blood flow and the vagal tone becomes decreased. There's also genetic variations as well. And I think this has to do more with the inflammatory response and the way that the body is responding, the innate immune system is responding to those signals, become dysregulated. And then kind of as a general, we talk about autonomic dysfunction or immune homeostasis dysfunction, which are just fancy words of saying the nervous system just isn't responding the appropriate way. And we know sometimes that's because of a heightened stress response. And so we're not getting that proper off switch. We're not getting the proper signaling to just, cool the flames, essentially.
So that's really that's a really relevant point, I think, in today's society where we are living the lives that we're living, which is absolutely the most pressure I think we've ever had to produce and be productive in the history of time. And then we have these super high expectations of being lean, having great gut health, and doing XYZ, right? So, to kind of give people perspective, it's can we expect all of that? can we realistically expect to keep living? And COVID has really shoved us into a different state of living now. But before COVID, where everybody wanted to do the things, have the best social media accounts, the best career, a really happy, healthy marriage and relationship, be the mom, the single mom, whatever, dad, it's so much. And that how we respond to that stress, you've always taught me it's about the response to stress. Stress isn't going to go away, but it's how we internalize it and how we then act it out. So, you know, if we don't have a lot of tools, this pulls in the role that personal development and healing therapy, all of that stuff plays in being able to improve our stress response so that we actually have a fighting chance at reversing metabolic syndrome and clearing chronic latent infections. Do you agree?
Mm-hmm. Yeah, definitely. Yeah. And I think this is, you know, there's other studies looking at, and we've seen this in clinic quite a bit, is we're seeing more and more people presenting with chronic infections. And these are infections that we call opportunistic. So, you know, candida, for example, we all have candida, but for whatever reason, our immune system isn't able to appropriately keep it at bay. And so, you know, women are getting chronic vaginal yeast infections, or they're presenting with a high level of yeast in the digestive system, or we're seeing like recurrent EBV, mono, parasites, bacterial infections, where it's showing us that the overarching immune system's response is being depressed. And so I think a big factor to that has to do with the nervous system, and that signaling that's supposed to happen to help encourage the innate immune system, kind of our first line defense when it comes to clearing these types of infections, supporting it properly.
Yeah.
Right? Mm-hmm.
Yeah. So wild to me. I'm so amazed by this stuff. Okay, so where did you want to go somewhere in particular?
Yeah, I think, you know, what we wanted to kind of focus on too is obesity and metabolic syndrome. So why is it that so many people are experiencing kind of rapid weight gain? I'm seeing a lot of leptin resistance, insulin resistance. Is this truly just because of carbohydrate overload?
Mm-hmm.
No, it's not.
Wow.
It's not. So what's interesting about this is, you know, when people have gained weight, we know that the fat tissue itself produces more inflammatory cytokines, meaning that it increases inflammation in our body. In addition, there's kind of this chicken and the egg, it's what's been associated is a decrease in the vagal tone in people who are obese. And what I find really fascinating is they've connected the vagal tone, so the ability of the vagus nerve to communicate with the gut. It actually controls our intestinal permeability. So after a high fat meal, what they've shown is in healthy people, there can be something called endotoxemia. I was talking about that earlier. So there's high fat meal, it increases LPS, which is a bacterial byproduct, and then it gets into, then there's a leaky gut essentially, and this causes endotoxemia. So an increase in inflammation, which is found within the liver, in the hepatic portal. And then the vagus nerve senses this, it tells the brain, okay, we need to reduce the inflammation here. But in people with obesity, and who have a decrease in the vagal tone, they're not getting that inflammatory reflex to help to seal up and stop the what's called postprandial inflammation and hyper intestinal permeability.
Yeah, so leaky gut.
So leaky gut. And then they have what's called endotoxemia. This is related to leptin resistance, as well as a decrease in the liver signaling to help shut down the body's own production of blood sugar. So essentially, a high-fat diet is causing leaky gut. It's allowing all those bacterial toxins to get into the system, causes inflammation, and then the body's not responding properly after a high-fat meal, so the liver is still pumping out tons of sugar, blood sugar. So what you're seeing is now high cholesterol, high free fatty acids in the blood, as well as high blood sugar. And so you're starting to get into metabolic syndrome.
So if they are insulin resistant and potentially already type 2 diabetic, so we're not going to be asking them to eat carbohydrates, and they are also intolerant to the fats because of this whole downstream cascading effect of eating a high fat diet, vagal tone, etc. How can we troubleshoot that? How can we get people nourished and stop the injury from happening?
Yeah, and this is why we go so detailed and micro focused into why this comes up, because now it's telling us exactly how to address this. So we know in the short term we're going to need to help to decrease the bacterial load, so pathogenic bacteria and that production of LPS. So these are antimicrobials. We need to support the gastrointestinal lining and essentially heal the gut. For a short time, yes, we want to make sure that we're reducing its saturated fatty acids. So focusing more on polyunsaturated, monounsaturated sources of fat, clean fats, unprocessed, unadulterated, and then decreasing the processed kind of simple carbohydrates, focusing more on complex carbohydrates, fibers that we know are going to build up our beneficial microbiome, right? And then the key to all of this is then working with the vagal nerve and the vagal tone. So assessing, is there past traumas? Are they working with a psychotherapist or a trauma therapist, or
like a somatic healer too, like bioenergetics, like learning how to clear trauma physically from the body.
Yeah, and then physically, I went and I wrote a list here. Let me just get it.
Oh, amazing.
So what's really, this is where I geek out. What's really cool is, so we talked about the acetylcholine receptors as kind of being key to this whole vagal pathway. Well, there's actual vagal stimulation that you can do. So this is, a brain implant that can happen where people, so they do this for depression. They've also done studies for people with resistant weight loss, or weight gain. And they stimulate the vagus nerve by inserting an electrode, and this causes rapid weight loss as well as improvements in mood. So I'm not a surgeon, a neurosurgeon, so I can't implant these into people's brains. But what I can do, and what there are studies, is using TENS or electroacupuncture. So acupuncture through auricular acupuncture and then different points around the head, we can actually stimulate the vagus nerve through the branches that are located in that area.
Okay, so what would that look like? It's like a pen, right?
Well, there's a few different ways. Yeah, I think some practitioners just have a pen. I would put in the needles and then attach it with little alligator clips to a machine that puts current into the acupuncture needles.
You do that?
I've done it, yeah. And so after this, I'm like, oh, this would be great to add in.
Okay, yeah. Yeah. I'm gonna come visit you and do some of this electroacupuncture.
Yeah. I know other practitioners, chiropractors, they do this as well. And so it's about stimulating those appropriate points around the vagus nerve to help to improve the tone.
And how often would somebody need to do that to see long term? Is it something where you're doing it throughout the course of the anti-infection protocol, the trauma therapy, etc.? Or is it something, does it kind of come back on board at a certain point where you don't need to do that anymore?
Yeah, I'm sure it does. I haven't looked at, the protocols and how often, but typically with acupuncture, it's twice a week. Yeah. And then you're doing that over a course of, 6 to 8 weeks and then reassessing. So I would imagine it depends on kind of what the other therapies are. Yeah. If it's like the saying that I have with my patients is, if you have a tack in your foot and you're taking anti-inflammatories or painkillers, you're going to be taking that until the tack's gone.
Right.
And when we're doing these sort of treatments, we're not going to make long-term shifts unless we look at, changing the behaviors, changing the mindsets, and helping to heal from some of the traumas, whether it's physical or emotional, that are causing some of these autonomic dysfunctions.
Yeah. It's complex, eh? It's a lot when you look at it. But I think, as somebody who has been actively working toward healing my vagus nerve for so long and had periods of increased and decreased, success, that I love just level setting with people. Hey, this is big. It is big. And I know it can feel overwhelming. What do we have but time? You're going to be living anyways.
Yeah.
Why not put the energy into health supportive learning about, who you are, what you need, what your genetics are, what your traumas were, how to, use food as medicine and create boundaries and all of that great stuff that will not only help to heal, but enrich your life, versus staying in that holding pattern of, oh my God, that's so scary. That's too much. I don't want to look at that,
Mm-hmm. Well, I think that's a good point too, as far as these are daily habits and rituals. Health is so dynamic because it all depends on our environment. We're not in a bubble, and once we reach, a state of health, it doesn't mean that that's it, and we're just cast, as that, perfect human thereon. We're constantly aging. We're constantly changing our environment, changing our food, our nutritional status, our stress, our environment, all of it. So it's really about daily habits. And, there's some other research around heart rate variability. Yeah. So just making sure that you're increasing your heart rate variability. And there's a center called HeartMath. So they have some devices that people can put on their phone. You attach it to your ear, and you can kind of do a check-in to see what is your autonomic system doing. How well is it responding? And then depending if you're, in that fight or flight and you're having a hard time kind of coming down from that, then there's exercises, there's breathing exercises. We know that yoga in certain positions will help with vagal tone. I mentioned the acupuncture, singing, like gargling, the gag response, anything to help stimulate those, functions in the body that are using the vagal nerve. It's like you use it or you lose it, type of deal. So I think in this case, it's where they're losing it because they're not doing anything in their daily habit to continually support its health. We're just over accentuating, the sympathetic drive. Yeah, the stress response. So we're really great at planning and worrying and multitasking and and survival, right?
Yeah.
Which we equate to success in some distorted perspectives. So.
Yeah. I love this conversation beyond belief. It's so amazing because it's so well-rounded. It just makes sense. It makes total sense.
But I think on the other side of it too is I always love working with herbs. I love working with medicinal herbs. And there's a lot of plants and a lot of supplements that we can use to help increase the body's acetylcholine production, as well as our GABA and our glycine production.
So can we unpack what that is though for people because they might not know?
Yeah, so we have our kind of stimulating neurotransmitters. This is the stress response. So this is like cortisol, adrenaline, noradrenaline. Some of the other neurotransmitters like serotonin will have modulating effects. Dopamine is more stimulating. But then the brain has these other chemicals which help to calm the brain. So those are things like GABA, glycine, acetylcholine. And so these are more responsible for decreasing that stimulation within the brain, calming the nervous system, and then facilitating all of these functions of the vagal nerve.
Mm-hmm. Okay. Yeah. Mm-hmm. Sorry, so I cut you off. So you wanted to keep talking about, GABA, these down-regulating neurotransmitters that are produced when you introduce the right herbs or...
Yeah, so from an herbal standpoint, there's good research looking at things like bacopa. So this has been shown to increase acetylcholine. Something called gotu kola, ashwagandha, rhodiola. There's something called hupuricin A. So you'll see a lot of brain supplements for memory with these formulas in them. So we can actually take these to help increase our body's own production of acetylcholine. And so one of the reasons the vagal tone could be poor is that you're not producing enough acetylcholine.
Yeah.
So just by increasing the body's ability to produce these neurotransmitters, that can help. And plus you're decreasing those stress hormones. So you're helping your body shift into kind of that calm state, which is where we need to be.
Did you want to keep going with that?
Yeah.
Okay, keep going.
So there's herbs, then there's supplements. So we know that acetyl L-carnitine helps as well, taurine. There's something called CDP choline or citicoline. This helps to produce acetylcholine in the brain. There's a really good supplement by Designs for Health, alpha GPC, which is another type of choline that I like. It's a liquid form. And then glycine is awesome as well. Yeah. And then there's behavioral things too. So what is it that you practice every day to help with your vagal tone?
Yeah. So it's so many things. It's like cognitive behavioral therapy. So I think because I grew up in such an inflammatory home where I saw so much reactivity, that deconstructing that reaction in, how we internalize information is communicating to the nervous system constantly. So the way that I would hear something wasn't necessarily how it was intended. And I would have this defensive, highly inflammatory reaction where I was known to be quite sassy and, confrontational at times. And my practice in nurturing the parasympathetic, my parasympathetic system is in NLP work, the neuro-linguistic programming, where after doing that training, I started to understand the way that I see the world isn't necessarily the way it is. And I have a choice in how I want to interpret information. And so I look for the proof, that took training. It's like, I lean in. I'll check in and ask people, is this what you intended? Hey, I feel a little confused about that. I felt a little weird. Do you mind if we talk about what that actually is for you, what you meant? Processing difficult situations, like communication and having like a strategic way of thinking about things has really helped to coax my nervous system into a more rest and digest state, as opposed to just letting my wild, untrained mind make all these assumptions and get angry and offended and all of these things that really kept pulling me into that sympathetic overdrive. So those are some things I use a lot of, like when I attend lectures and hear different, Reiki masters or therapists, or, even you, like conversations with you over the years, these reframes where people are like, you show up with a complaint or a way of looking at the world, and somebody has this way of pulling you out of the black and white and considering the gray. Well, what if it's actually possibly like this? And it just feels nicer. It's calmer in my body, So I really love talking to people who have done the research and have done the work on themselves and are constantly reading and finding new ways to, look at life situations, because the nervous system is always listening. And I've noticed that huge transition in myself as I've trained my mind, that I actually feel calmer in my body. I can be present. My social anxiety is decreased. I can sit in a group and use my voice without the fear of judgment or being ostracized, it's so complex, right? Like everybody's method is different. What are some of yours?
Well, I think you kind of hit on the first steps that people can take which is starting to be able to self-observe,
Yeah.
right? That's kind of like the first step. We're so used to just reacting. Many people don't even think that they have a choice in the matter. You know, they think they are the thoughts that they have. And if you think about it, you know, you can hear the voice, you know, and the voice will be saying something, but then there's a part of you that is able to say, huh, what is that saying? That's a sign that that's not you. You know, you're observing something. And so, you know, a first step to be able to start to give yourself the space and the time to just kind of observe some of those thoughts. A lot of it comes with practicing mindfulness. So that's, you know, what I got into a long time ago now when I was in school, which helped significantly. And it's just been an ongoing practice from there. But with some people with a history of like PTSD, it's actually better for them rather than do things like meditation and deep breathing, where you're just kind of sitting, you know, on a mat. That can be really, you know, triggering to them. So it's more the movement, like walking yoga or walking meditation, yoga, that you want to start with, because that kind of gives your brain something to focus on while you're kind of able to observe what's going on.
Yeah. I love that you hit on that point because, you know, I've been working with Blue Matter Project here in Toronto, which is a yoga community that offers trauma-informed yoga and meditation. And as I have, you know, learned more about how they offer that trauma-informed care, it really is about creating space for people who don't feel safe being still and don't feel safe with their breath. Because we gravitate to these modalities that are, in theory and globally, you think, oh wow, this is what helps to transform people's stress responses. But for you, you might be the most uncomfortable in those spaces, and that further perpetuates this cyclical pattern of stress responses, right? Why am I not like everybody else? Why can't I do this? It just starts to really pull back into the trauma. That trauma loop. So it's really great, I think, as we're talking about healing the nervous system and rerouting neural pathways and responses, to also nod to, if you do feel really uncomfortable with a certain practice that you're trying to incorporate to help to heal the nervous system, please don't think that there's something wrong with you. You're not broken. You're not damaged. It's just not the right modality for you, and that's okay.
Yeah, exactly. And I think that's a really good resource for people too, is just go to the Blue Matter projects.
Yeah.
And that's a good place for them to start to become familiar with what are the resources out there. And start, one of the books that I always give patients is Mindfulness-Based Stress Reduction Workbook by Bob Stahl. So this is based off of a program from the University of Massachusetts, where they taught mindfulness to veterans. And over 5 weeks, just by doing this mindfulness practice, they were able to reduce their symptoms by 80% after 5 weeks. So I've seen it time and time again when people really commit to doing this, and it's not time consuming. It's just a matter of creating that habit.
Yeah.
So that daily practice, it really does make a difference. Breathing work as well. And lately I've been into Wim Hof. So that's been my jam, doing deep breathing. And for people who aren't familiar with Wim Hof, it's doing almost hyperventilating and then holding your breath, and then letting go. And this, you know, I think it's forcing your body to get into that parasympathetic. That's what a lot of the breathing exercises do, is it switches the brain, flips it into that parasympathetic state. So even just the last 25 days of doing that, I've noticed even now, yeah, the effects that it can have.
I was going to say, what do you notice? How's that?
Yeah, just able to kind of catch the rhetoric that's going on a little bit quicker. And right now I'm just focusing a lot on kind of, with this downtime, what's coming up. Because a lot of times when we're still, you know, we don't have the distractions that we usually do. is when the real information comes up for you to work on.
Yeah.
So rather than trying to push that down and find other distractions, I'm looking at it, looking at it with compassion and saying, okay, what do I need to work on? Who do I need to reach out to for help? And just trying things.
Yeah. Yeah. Wim Hof is pretty powerful. It's pretty powerful.
Yeah, it's interesting.
Mm-hmm.
I tried to get my parents to do it, but my dad said, this guy's just too hilarious.
Really?
Yeah.
I mean, he is pretty hilarious. He said he has an app, right?
Yeah, the Wim Hof. I just looked it up on the Apple app, whatever that's called.
Okay, cool. Yeah. So I wanted to, before I get into a recap, I wanted to just ask if, I know you did some great prep work. Was there anything else that from that study that you wanted to touch on or share your perspective, your thoughts on?
No, I think we hit the major points. We know that, it's the vagus nerve. If it's not functioning properly, that we're seeing changes with how we're responding to the foods that we're eating. We're seeing leaky gut. We're seeing chronic inflammation, and this is what's perpetuating rapid weight gain and just metabolic dysfunction. And so unless we're addressing the vagus nerve and the gut health, we're going to see perpetual, yo-yoing in dieting or recurrent infections, say with SIBO or gut health. We really need to address, both at the same time.
Yeah. Yeah. So we've talked a lot about, it could be that we could do acupuncture, we could do electroacupuncture, mindfulness, anti-infection protocols, all of these things. So just so that people don't feel like, I think a big thing for people when they read blogs or they watch webinars or, whatever these talks, they go, okay, that's a lot of really cool information, but what do I do with this now? So, my personal opinion is you find a specialist who can present a plan and walk you through a strategic protocol. What would you say would be a really good course of action?
Yeah, I'd say first of all, in the beginning is to start developing that mindfulness. And so reaching out to a Blue Matter project or getting that book on Amazon. These are things that are accessible to us right now. And there's, so many apps and so many resources just to be able to start doing that. Mm-hmm. And that's the first step. We need to be, reducing the stress that we have in order for the vagus nerve to be healthy.
Yeah. Yeah. Amazing.
Mm-hmm.
I love this talk. Thank you so much.
Yeah, you're so welcome.
Where can people find you?
So go to my website, www.drrobynmurphy.com, or any of my social media handles, just at Dr. Robyn Murphy.
Amazing. Amazing. Mm-hmm. Thank you so much.
You're so welcome.
Great.
Thank you.
Okay, I'll call you after.
Sounds good.
Okay, thanks guys. Bye.
Bye.